Welcome to Heal the World Show podcast, brought to you by the Healing Institute. I'm Parmelia Parham, and I am the founder and the CEO of the Healing Institute. The Healing Institute is an online, worldwide hub of holistic practitioners. And we have a big ask. We're doing a big job. We're out to heal the world. And so we are asking for you, the listeners, to definitely connect with anybody that you know that is looking for alternative ways for their health journey and have them come to the Healing Institute website and connect with our amazing practitioners. So I've been using holistic health and alternative health myself for well over 20 years, and it works. And I really truly believe that we need to have a different medical model than what we've had for the past 30 to 40 years because it seems to be broken all over the world. And so you might ask me then why this is so important to me. Well, I always tell this story on the podcast that we had a very tragic event happen in our family over 30 years ago. But still, it was because my mom had been on a medication for a very long time. And not once was she ever told that a side effect of that medication could be kidney failure. So we lost her at age 61 just before Christmas. And also, I was 5 months pregnant with my son. So not only was it a tragedy that she died so young, but also that she didn't get to meet her grandchildren, my children didn't get to meet her. You know, I just don't want that happening for anybody else. And the reason I called the Healing Institute an institute is because I'm really passionate about education and educating people how to be well and how to stay well on their health journey. Because let's face it, we're all on a health journey. So we want it to be a wellness journey, not an illness journey. And that's why I have these amazing co-host practitioners every week that I have come on and help me talk about the kinds of wellness that we want to have in the world. So today, actually May, our theme is women's health. And so today we're talking about hormones. And so I'm really, really excited to talk about this particular specialty and welcome Victoria Mondlock and Deborah Jackson, who have an amazing wealth of knowledge around this subject in particular. And so Dr. Vicky and Divinely Deborah, welcome to Heal the World Show.
Thank you very much.
Thank you so much. I appreciate being here and being your guest and being amongst such rarefied air.
I love how you explain all of that. And just so people know, we're having a little bit of a technical glitch in that we can hear Deborah, but she's for some reason her screen is frozen, so she's not live. But she is live. She's there. So we want to also say hello to some people that have hopped on already to the show. Dr. Madlena is her company is called Living Your Best Life Guide, and she says she's very excited to be here, and we're excited to have you here, Dr. Madlena, because she's coming in all the way from Germany. Marie Piplovic, who is one of our holistic practitioners. Oh, I should mention that Dr. Madlena is on the Healing Institute Advisory Board, so we love the support that she gives us there. And yes, she says hello from Germany. Marie Piplovic is from Portland, Oregon, and she is one of our holistic practitioners. She helps with women get through that phase in their life when all of a sudden you're stuck. She's also an amazing breathing facilitator. So definitely connect with Marie. Oh, we have someone, Jill Rowland. Hi, everyone from Nova Scotia. So perhaps that's someone you know, Deborah, that you
absolutely.
So that's fantastic. So let's get into this subject. So we want also our audience likes to know some results of your clients having worked with you. So, Dr. Vicky, what you go first? Let's talk about some of the areas that you're an expert in, especially around women's health and hormones.
Well, thank you for that introduction. I'm a board certified OBGYN, recently retired, but what I also did was add regenerative medicine, complementary alternative medicine, and energy medicine to my practice so that I could have a well-rounded approach to my patients. My patients also were as frustrated as I was going through my menstrual career, because once I hit perimenopause, my body and symptoms changed to things I didn't expect. And if I didn't know how to handle them, how could I expect my patients to know how to handle them? At the same time, I was lucky enough to be able to do research with my patients' permission and utilize their blood values and trend and track them to develop the curves for where hormone levels should be for age appropriate, for where you are in your career. And that's something medicine does not do. They do not look at whether or not you're age appropriate. They just look at whether there's hormone there or there's not hormone there. It's a yes or no. Are you in
Well,
range? Are you out of range? So I was lucky enough to do that type of research.
Well, that's just fabulous research. I mean, I know when I was going through that situation, and I had a hysterectomy, so I didn't go into menopause right away. It took a couple of years, but then all of a sudden I was getting all the symptoms. And at that time, this is something I want to talk about today, because apparently there's been more research that's come out about hormone therapy and how that works or doesn't work. But I remember doing the research for myself with my gynecologist, OB/GYN. She was very helpful with me because I had a lot of fertility issues. So actually, to get my children, we were partners for sure. So I really trusted her, and she just said, "Well, it's up to you. You make the decision." Back then, which was like 40 years ago, if you had cancer in your family, then you shouldn't go into hormone therapy. Well, I didn't have any cancer in my immediate family. So I looked at all the research, I read all the books, and really it was 50% one, 50% the other, because I was still having all of these issues, these, night sweats, and actually not even just being hot, but what happened for me was I was really becoming claustrophobic. So I decided to go on hormone therapy. It did not fit well with me, and the side effects of it did not feel well. So I ended up going off of it. But again, it was kind of up to me to decide whether what I wanted to try and what I didn't want to try. And there was never any discussion about, I was probably 42 at the time, 43. There was never any discussion about whether or not that was age appropriate.
Mhm. Well, and that's exactly right. So, and I would bet as well that while you were trialing the hormone replacement therapy, you would never had baseline levels done or had levels done to follow where that therapy took you. In other words, where was the science, in
Right.
your quote trial of taking hormone therapy? So the only way to know is to see the result, but you have to know the trending. Are you where you're supposed to be? And many infertility patients are actually in estrogen dominant situations already. They are in
Yes.
endometriosis, which is an estrogen dominant, or
Yeah.
they have fibroids, which is estrogen dominant, or polyps, or super heavy periods. All of those are estrogen dominant situations. There's also polycystic ovary, which is highly genetic. Nobody talks about its genetic basis, but that's when you actually act perimenopausal from adolescence all the way through to
Oh.
menopause. And you are many times, months and months at a time, more male dominated than female in your hormone profile. So unless somebody explains that to you and you have an opportunity to manage those conditions, you're basically just shooting in the wind.
Exactly.
Have a
Totally.
clue.
That's what I felt. I felt like I didn't know what I was doing. I ended up going to a naturopathic doctor finally. Getting off of the hormone replacement that I was taking, and doing more of a natural phytoestrogen that helped with the symptoms. But really, I didn't know. I was just trying anything just so that I wouldn't be, up in the middle of the night, feeling
Well,
claustrophobic and
right.
and having night sweats. So,
Mhm. Right. And,
um,
and that doesn't even speak to one of the other hormones in the body that many times just adds fuel to the fire, and that's your stress hormone, your cortisol.
yes,
So as you're going through that type of a situation, you don't realize that your cortisol is going up and up and up, and that has an imbalancing further effect on your female hormones. So the body talks to itself, and we tend to forget that.
well, we're learning that though. That's what makes me so excited about knowing the new science that's coming out, all the different theories that are coming out. Some of the new. I was just reading about the difference of what hormone therapy, how it was looked at say 10 years ago, is not how it's being looked at now. And there was some misnomers out there. There was some misinformation. So
Very
you
definitely.
know thank you that we finally are getting on the right track, and that we're finally getting some science-based information about how our bodies work. And we're learning that more and more all the time anyway. We're learning that our bodies are a pretty amazing vehicle. We just have to give it the right tools to work at its
Right.
optimum.
Well, and one of the things I would always say to my patients is, why is hormone so good for us from puberty to age 50? And then from 50 on, it is suddenly a demon and it's suddenly horrible for us. Wait a minute, we're the same body. They're the
Mhm.
same hormones. So why is it a flip of a switch when we hit menopause? And the reason is that nobody had done the research. And you say, well, yes, they had. They did Women's Health Initiative, the big American study, the Europeans mirrored it. But the interesting thing is that they came up with opposite results. Europeans or the Americans came up with an increase in breast cancer, heart attack, and stroke if you took hormone replacement. And the Europeans came up with the opposite: no increase in breast cancer, decrease in heart attack, decrease in stroke, decrease in osteoporosis. And what we later found out was also decrease in Alzheimer's. So why? Why the
Exactly.
opposite results? Well, the Americans were not looking at and studying bioidentical hormone. They did Premarin, pregnant mare's urine. What?
That's what I took. Yeah.
Pregnant horse pee, right?
Yeah,
Oh
really.
my gosh. And Prempro, which is Premarin, plus a synthetic chemical called medroxyprogesterone acetate, which, by the way, is the shot for contraception, which causes infertility and breast cancer.
Wow.
Well, and now I've been reading lately that Dr. Jill Biden has opened up there's some new money that's now been available in the United States. We don't seem to have the same thing happening here in Canada, but that there's some money, a good portion of it, that now has been put forward to study women's health. Can
And
you make
there
a
are four
comment on that?
women. Yeah, there are four women senators, one from my home state of Wisconsin, who are involved in this $287 million proposed bill. It hasn't been passed yet, but it is also with Halle Berry as a spokesperson, as a Hollywood spokesperson, saying that women's menopausal issues need to be studied. And it's about time, and it's unfortunate that it takes certain voices to push something that we've been needing for a long time. I've put a letter into my state senator to hopefully get an audience with her. But yes, it will welcome any help that we can get.
Well, let's weigh in here. I want Deborah to tell us a little bit more about how she works with clients and their hormones. And any, of course, case studies that you have, Deborah, that you can give us some ideas of how your clients have been able to improve their health or increase their health around the work that you do with them.
Wonderful. Well, thank you so much. I really am enjoying this conversation, and much of what you're talking about has been my own personal experience with cortisol. It has been something that I have navigated my entire career. I come from a background of wellness and beauty. I was licensed in the beauty industry many years ago, but absolutely dove so deeply into simply by navigating and rewriting my own story, women's health, and found myself aligned with beautiful voices and resources like Dr. Victoria and yourself, Premilia, and many other women that I work with. So I collaborate and I work primarily as a mindset coach that supports women in taking all of the overwhelmingness of what they're facing and support them in narrowing it down. And then I work with them to help them bring down inflammation. I improve gut health, the gut brain connection. And then what I do is I refer out. So I have, if you'd say, like a faculty of people that professionals that I can call on. So I work with, dietitians, gut brain health practitioners, resources like Victoria Monluck, who's written a couple of amazing books. And we simply bring and bridge this information together and bring access to women that are looking for information based on how we weed through all of the processes that they're going through. Because many times what happens with a woman, she's completely bogged down and she doesn't know where to go. And the first place to look is from within. And if we can support her in cooling down the inflammation so that she has a rise in her vitality, perhaps her cognitive, then she can view her menopause journey or her wellness journey from a completely different lens. So that's in part what I do. So I would throw that back to Dr. Victoria Monluck to expand upon, because I see her agreeing with me in that this is a wonderful correlation, because many times what happens is that we go to a doctor, like I went to a doctor, I was prescribed the same type of hormones that you were in 2014. It threw me into a downward spiral and a 2-year depression that I had to navigate through. And so I've always been a person that has navigated my journey by being completely conscious, finding, doing my own research and integrating new ways to cool my own body down so that I could stay in my body and stay in my career. Because many of us are navigating menopause or life changes, and we're still in a full-blown career, or we've gone from retirement, like I have, to refirement. I have a brand new career, and I'm in my mid 60s, not giving my actual age, but I feel like I'm doing really, really well based on taking the natural route and having people like Dr. Victoria Monluck in my court that I can call on, and people like yourself and other doctors, because it does take a village.
It totally does, Deborah. And thank you for, also bringing to the point about the research that we have to do. And oftentimes we're in all of this perimenopause or in full blown menopause or going into it, and we really don't have the tools, or I didn't feel like I had the tools. I mean, my children were quite little; they were young. I had a career with the Canadian government. I was busy, and I still was trying to navigate all of these symptoms and what was making me stressed out. Because actually, I'm so glad Dr. Victoria talked about the cortisol, because I didn't at the time understand how that was all working. But with what was going on with me, and I'm sure with many women, is that was the stress hormone that was also blowing things out of the water. So, and not in a good way. So,
I understand, because, as I said, I have navigated with cortisol coursing through my veins in not a good way. And it can really sidetrack us. It can
mhm,
immobilize us. It can shut us down. It can cause so much stress that we don't have all of our body working and in synchronicity so that we can flow through life. And I know that Victoria can speak deeper into that topic. But I believe a lot of women are dealing with this, and there are ways, there are best practices, there are natural approaches, along with, getting with the right practitioners or the right grouping of professionals that can guide you organically, not just throw a hormone at you because
exactly.
you're at a certain age and you come walking through the door, and there's I've heard Victoria talk about this, that the doctor has no time to really speak to you and sit with you and organically look at you as an indivisible whole person. And that's what I love about what Victoria does.
Well, thank you for mentioning that, because it happens too with so much of our medical model that we've had in the past. So, you only had 10 minutes with the doctor. Maybe you had four things you really needed to talk about, but you got to two. Or, now that I was talking to Victoria early about her offering about the worksheet that she's available for people, and in fact what was happening was that you would forget, because you were in this, you all of a sudden you couldn't remember all the things you wanted to talk unless you kept notes. I always kept notes. I just want to this is a great conversation. I'm just really excited about all the information that's coming out. I just want to acknowledge a few people that have popped in to listen to us today. So Dr. Madlena says it's a great approach, Dr. Victoria. And also this is information that she's hearing for the first time. So thank you for sharing. Barb Ashcroft has popped on today. Thanks, Barb. She just lives down the road from me here on Vancouver Island. And then Dr. Madlena said how important to mention the role of cortisol. Jill Rowland said, great point, Victoria. She made lots of points, so not quite sure which one. And Alden Darville saying hello to Deborah Jackson. So this is good. Marie Pitlovic says, it seems to drop into menopause as a result of surgery. Or just a minute. I seemed to drop into menopause as a result of surgery and subsequent blood clots, but I didn't notice it because of emotional stuff related to my burnout and recovery. I've focused on using my own breath. Marie's our breathing facilitator, to move through my recovery and menopause with no hormones. Well, that's great. Absolutely. Maybe, Dr. Victoria, can you speak a little bit to how surgery might trigger menopause that way?
Well, it's many times people think of, and they hear the term hysterectomy, and they think that means all female organs are taken out. And that's not the medical term for everything being taken out. Mm-hmm. Many times they will take the uterus, but they will leave the tubes and ovaries behind. If your ovaries are still there, there is one of two things that can happen. They can continue to function normally, and you will go through your normal menopause. But many times what you're never told is that the blood supply to those ovaries gets compromised. And if that blood supply from doing clamping and cutting and stitching and taking out a uterus, if that gets compromised blood supply, then they're not going to be, quote unquote, as healthy. They're not going to be able to make the same hormone if you had any kind of difficulty with your surgery. You might actually shock your ovaries. That's called Sheehan syndrome. And then they stop working for variable amounts of time. People can even go through a shock to their ovaries without going through a surgical procedure. and their ovaries can actually be dormant or go into a premature menopause for years. I had one patient that came to see me at 36 with that diagnosis, and I said, given your history, I don't believe that's your diagnosis. She was 36. We had to do something. So we did work with hormone replacement, and all of a sudden her levels shot up. It took 5 years, but all of a sudden her levels shot up, and we started backing down on her replacement, and her ovaries kicked in and they took over. And she said, well, this is great, but what does this mean in the long term? I said, well, what it really means is you get to go through menopause a second time. And she went, what?
Well, thank you very much, Dr. Vicki.
I said, well, but it's better to know
Yes.
than not to know, because
True.
now you know we can manage it.
Yeah.
And
And
so
to know
she
what to do for it.
Right.
Exactly. Yeah.
very gracefully went through it. So in the case of the comment with having blood clots post-surgically, I don't know if it was due to the actual procedure. I don't know if there was any major blood loss that happened, or if there had been an enlarged uterus putting compression on a blood vessel that then released its blood clots. There could be a couple of different reasons that are probably not appropriate to go into with HIPAA rules and talking personally about an issue publicly. But there could be other reasons that may or may not have a hormone-only reason.
Yes. And also Barb Ashcroft is mentioning that our passion is to lessen that inflammatory response.
Absolutely.
We're only learning the science now around, if you have a pain or discomfort someplace, it's due to inflammation. If you have any kind of itis, like arthritis, bursitis, whatever, it's due to inflammation. So we're only now learning, at least, I'm sure as a doctor, you already knew this, Dr. Victoria, but we're now learning that once we reduce that inflammation with the amazing tools that we're all working with, then it's gonna really assist and increase our wellness journey and
Right.
really help us be
Right.
more
And,
well.
two things I'd like to say. One is most people don't understand what the role of estradiol is in the body, our main female hormone. We have estradiol and we have progesterone. Well, the main role of estradiol is to increase blood supply per square inch to tissues with estradiol receptors. So I'm going to say that one more time. Its role is to increase blood supply per square inch to tissues with estradiol receptors. They're in our hair. They're in our hair follicles. They're in our skin. They're in every organ in our body, our joints, our muscles. Every place in our body has estradiol receptors. So what happens when estradiol with menopause goes away? If we had increased blood supply per square inch, what happens when estradiol goes away? We decrease blood supply per square inch to our skin, to our hair follicles, to our muscles, to our joints, and we get itis. To your point, Parmelia, we get itis, we get inflammation, and that inflammation can progress to arthritis. It can progress to gastritis. Inflammation or itis can be anywhere that you are no longer seeing those same levels of blood supply.
Well, thank you for explaining it like that. I've never heard it explained like that before, but it makes perfect sense. Just a couple more things. Someone is here. Diane Rosso is grateful for Dr. Victoria's wisdom on her health journey. So welcome, Diane. Marie said she had had back surgery. And another question Marie has is, how old do you think a second time it could happen? I guess that second menopause experience.
Well, interestingly, I went through menopause when I was 57, which seems really late, but the healthier your body is, the longer your menopause may take to come on. And I'm not trying to say people who have an early menopause are unhealthy, but there may be other imbalances and other issues going on in their body. So what I also tended to find in my research is that women who went through menopause would go through a last hurrah, and they would spike one more time with hormone. And some women would spike to about a third of the levels they would normally make at age 30. Some people would really spike and have a tremendous 300% spike. But
Wow.
everyone spikes. Now, that woman with the 300% spike, she was at high risk and had an abnormal mammogram. Well, gee, what a surprise. So that took a lot to quell that 300% increase. But if you don't know and you're not looking, she might have progressed beyond just the bad mammogram to something worse. So a second menopause is kind of most people don't go through premature menopause unless there's a shock to their ovaries. But every woman who goes through menopause may quit, have a last hurrah for 2 months, 4 months. I had one patient who would last hurrah every year around the same time for 5 years until she finally quit.
That's
so everybody
interesting.
has their own cycle. Right.
Yeah.
Right.
Well, this has just been such a delightful conversation. I don't want to quit. So any last thoughts from you, Deborah, that you would like to? I know you have a menopause guide, so we are going to be offering that to all the people that have popped on today. Do you want to mention a little bit about what that is?
Sure. It's a menopause resource to support women in self-care, in taking a stand to be their own source of empowerment and to make decisions in how they view, how they want to evolve through this time, which is a time of great reinvention. And so that is, and I'm also, my information is in there if anyone would like to circle back around to me. I think this conversation is so robust, and I have so much more that I would love to add to it. And I guess we're at the end of that 30 minutes. However, it's just been fascinating to once again hear all of these valuable insights that really, really empower us and equip us with the right information so that we can make better choices. And because I really do believe that we don't have to accept what just anyone says. We are,
I agree. Yeah.
the conduits that we can assimilate all the information we want, and then we can determine and decide how we want to navigate that and who we want to navigate. But the one thing that I would love to leave everyone with is that we become the combined average of the 5 people that we most associate with. So choose wisely, choose healthy, wholesome people that are here to support you, that are not here to project upon you or dictate how your journey is going to go. It is about an empowerment, and it's a mutually equitable exchange. This is information that you take and make your choices in life, how you'd like to navigate.
Thank you for that. That's brilliant. And yes, please connect with Deborah. We've got the information that will go into the chat. And now, Dr. Vicky, I wanted to just ask you, there is a menopause symptoms worksheet that you're offering. Can you tell us a little bit about that?
Well, it's a tool and a resource that I used in the office, and I use with my virtual patients anywhere across the country. But what it does is it helps solidify where your symptoms are. It puts a voice to your symptoms, but more importantly, as we mentioned in the beginning of the show, if you can't get adequate time to get everything out, or you forget some, what you really want is something that will outline it for you. And it's low estrogen symptoms, low progesterone symptoms, and excess testosterone symptoms, because you may have everything on this list and you can't say that all in your initial statement to your healthcare provider. So it also gives you a chance to put the healthcare provider on notice. I've made a copy for you. Here you are. These are all the things I want to address. So that says to them, oh my goodness, I can't just send her to this specialist because there's a list of things here. Oh dear. Okay. But it gives you your voice. What you need is a way to get everything out you have going on. I write books about how you can do that. So the books are, Parmelia was kind enough to also put them on her website, but I have books on how you can talk to your doctor. The chapter in the back of both of my books says, here's how you talk to your doctor, the blood tests you want to order, because you want to check inflammation and you want to check where your hormone levels are. But Full Bloom is about the perimenopause, menopause, postmenopause woman. But don't forget the other female that also has hormone imbalance are our adolescent daughters and granddaughters.
Well, thank you for that. Please reach out to Dr. Vicki and we'll put her where to get her books in the chat. This has just been an amazing and really delightful conversation. And I'm so grateful for both of you to come on Heal the World podcast and talk about this very important subject that there really, there's so many women are struggling with trying to find the best way to navigate through menopause. And we just wanted to start the women's the May theme of women's health. We wanted to start with you two ladies so that we could really give some great information out to people. There will be a replay a little later this afternoon. So for those people that may not, there will be a replay. It'll come out. So you can, and I also do have it on my YouTube channel, which I'll be sending a link to both Victoria and Deborah, so they can send that out to their audiences as well. So we have a big ask. We are out to heal the world. We ask that you please tell people about the Healing Institute, about these amazing practitioners that we have, and we really do want to support everyone. Obviously, we're talking about women's health this month. We're going to talk about men's health next month, but we really do want to support everyone on their health journey, because we all are on a health journey. So thank you again, Victoria and Deborah. It's been delightful to have you here. And thank you to everyone who popped on live today, and to all of those who will be watching in the future of the replay.
Thank you so much.
Thank you, ladies.